Right, so we'll go ahead and call the meeting to order. Thank you, everybody, for being here. I am sitting in as the vice chair for Kevin, who is unable to be in attendance today. Megan, if you can do the roll call, please.
Yes, ma'am. I'll start with Providers Council. Kevin Marone, absent today. Okay, Vice Chair April Lott.
Present.
Steve Blank. Oh. Steve, I do see you there in the, you are muted, but I do see you in the participants list. Andy Coble. Lariana Forsyth.
Hi, this is Gabby Holton. I'm here on behalf of Lariana.
Oh, okay. Thank you. Erica Gist. Lieutenant Zach Haish.
Here.
Michael Gelazzo.
Here.
Christine Long.
I'm Carrie Roller. I'm here on behalf of Christine Long.
Ashley Lowry.
Present.
Dolores Rafa.
Present.
Mickey Thompson.
Here.
And Judith Warren. Okay. And now let's start Funders Council. Chair Kathleen Beckman.
Present.
Vice Chair Era Woodard.
Here.
Janine Evoli. Celeste Fernandez.
Here.
Amy Foster.
Here.
Blossom Capper.
Here.
Elise Minkoff. Dania Perez. Joe Riddle.
Here.
Julie Rocco. Elizabeth St. Pierre. Anne-Marie Winter. And Karen Yatchum.
Here.
And we do have a quorum for both councils.
Thank you very much, Megan. All right, first up on the agenda is the consent agenda, which includes the meetings from the last meeting and the attendance. I need a motion to
approve. Kathleen.
Second. Nobody willing to second?
I'll second.
Thank you. All those in favor say aye.
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 Opposed? Consent agenda passes. Thank you. All right, moving on to what I believe will be the bulk of the conversation is the update on potential legislative impacts on funding. And I do know that that Megan, or excuse me, Sherry had a meeting today. I think that it might be informative to us as well. Sherry, is that correct?
A meeting with, well, we received a contract from DCF today, very early this morning.
Okay, and I haven't read your email relative to that, but let's just kick it off with what we are hearing. I was really hoping that we would have a number of the municipalities who have, lobbyists and legal representatives and others who are probably tracking and, really paying close attention to the potential impact of federal funding and state funding changes, and really just want to hear predominantly from funders about what we're hearing.
I can start off a little bit, April, since I just talked to some Costa cities today a little bit about this very thing. So on our community development block grant funding and our home investment partnership funding, the funding we get for that comes from the continuing resolution that passed. So our funding that starts for October is fairly stable for those funds. I think ESG fits in that as well. We don't get that, but the county does, and St. Pete. The discussions at the federal level now on the budgets will affect October 1, 2026. And that's the critical ones. Right now, only the White House budget has come out. To my understanding, there's more discussion starting in July, but the White House budget basically zeroes out most of the housing programs and replaces it with a state block grant for about 50% of the funding level of the current housing programs. And when I say housing programs, I'm not talking just CDBG and home. It's family self-sufficiency programs. It's a significant amount of funding for both capital improvements and operating for public housing authorities, for rent assistance programs, a huge variety. I actually have a sheet I can send out that shows kind of a summary of the proposed, like the current and the proposed funding levels for those. So that's going to be one of the very critical components to advocate for full funding. Actually, Largo did just send letters out to our legislators this past, I think last week actually, recommending full funding for our programs and so forth. So those are huge impacts, and the state funding that we use for housing has some changes as well. So our state housing initiative partnership funding, a lot of that gets used for homeownership activity, just in the way it's created. But they are recommending full funding. And one of the changes that was going to happen to allocate more money to rural areas, that did not pass. So that was helpful for us, more urban areas. However, it's based on documentary stamp revenue from property sales. And so as the market slows, so does the money. So we took about a 30% cut from last year to this year, and we're expecting potentially about a 10% decrease from this year to next year, starting July 1st. Also, we get program income from loans that we have for housing programs. And so when the market slows, people aren't selling their homes as much. So that money coming back to the programs also slows. So those are some of the impacts that we're feeling at that state level. Some of the other programs, and to my understanding, I think Sherry might be able to speak more on this, but we just had a Sadowski affiliates webinar this morning. A lot of the homelessness related funding at the state looked like it fared at least even keel for the most part, in that they are cutting the Hometown Heroes, which has been a big home purchase program, which may affect staffing at some of our nonprofits more so. They cut that from 100 million to 50 million this year, and they are reverting it back to a smaller group of people that can apply, like professions that will be eligible to apply. So the last few years, it's been open to any Florida-based company. If you work for any Florida-based company, they're reverting back to emergency services, healthcare, that kind of thing for those, teachers, school workers, that kind of thing that they can fit in there. So it is going to be a little bit different, and it's not opening on July 1st, to my understanding, like it has in past years, because they're having to revert some of their program information for that different scope. So those are some of the big items that hit this year.
So Arrow, for the city of Largo, do you yet know kind of what these, the 30% cut, this year, 10% cut next year, all the things that you just listed, do you know kind of through the lens of the city of Largo, how you guys might be reconciling those reductions and what programs that might hit that's relative or related to kind of this group?
Well, our community development block grant money for this coming year stayed fairly consistent. So with community development block grant, we can only use 15% of the grant plus prior year's program income toward public services. So our subrecipient contracts with nonprofits. So this year, fairly stable, except for that program income. Our program income's down right now. We're watching. We have some potential payoff requests and things like that. So we're kind of in a monitoring phase with some of our loans outstanding that we've got some homes for sale. We're kind of watching literally to see if those come through and make us closer to what we had budgeted for funds on everything. But it definitely can impact also like public facility improvement money going for sure. If that happens in the future, if we were down to just our program income from our loan portfolio, it would be about half of what we currently have. So, yeah, we are in a monitoring phase with that right now.
Mhm. Okay. Amy, Karen, Joe, others?
I'll jump in, and I know Avery has some specifics from, I'm going to forget the acronym, but some groups that she's been participating in. But I think Arrow hit a lot of it. We are anticipating 183,000 less in some of our state funding this year, and so that will impact some of the housing programs that we run. As it relates to the federal stuff, I think that's the thing we're watching closely and very concerned about. Already, we just did a look back the other day to look at 2001 award amounts from consolidated plan to current. And just to give an example, in 2001, we were receiving more than $7 million annually, and we're under $2 million now. So it's kind of that death by 1,000 cuts that even if we don't see a significant cut this year, over time, all of those cuts add up. And, the majority of our consolidated plan funding goes to support nonprofit providers like those in the room. So, that's definitely concerning. I think one of the things I'm a little concerned about that came up this week, and I was looking for that, is, let me get to my advocacy folder. Hold on. Senate Bill 2502. I just received a summary on that late yesterday, and it may be innocuous, but it's basically a new state policy that allows the Office of Policy and Budget Authority to look at any local government entity. You basically have to provide them, I'm probably being bombastic, but whatever they ask for. And so, that gives me a lot of concern about home rule. But also, a lot of this Doge type of stuff. So I'm happy to share that summary with anybody who needs it, but that's something I just received yesterday and I'm starting to dig into to try and understand what are they trying to accomplish on this. But they say the purpose of these reviews of government entities, local governing authorities, and units of local general purpose government is to identify any use of resources for DEI that are inconsistent with law, any evidence of potential gross overspending, waste, fraud, abuse, and mismanagement of resources, or any duplicative or redundant government functions. And so, I just have so many open questions about this bill and how it gets implemented. So I'd say that's what's top of mind for me. Avery, I don't know, you had some updates from your recent call that you may want to chime in with.
I do, but honestly, Joe can be the one that fill you all in on that because he was there. He actually went with them and did some of the advocacy up on Capitol Hill. So I'll let Joe speak to that.
Okay. As you may know, I am the secretary of NACED, the National Association of County, Community, and Economic Development Association. One of the things I can say is that I can provide a little rosier a picture of the 26 funding that may be coming down the pipe. In February, when I was up in DC and we were doing our legislative work, we met with a lot of the appropriations committees. One of the good things that came out of that day of meeting with the Appropriations Committee is that we found they were operating as usual. They were gone, they had dug in, they were doing their reviews, and they were doing their work as normal. Now, when you came outside of there, you had all the wonderful stuff that's going around. We had one appropriations staff member that told us that, you know, the president's budget is a request. Our job is to review it. As we move along, our policy director updates us every other week of what's going on. The thing that we're hearing from, again, these appropriations committee is CDBG is a very vital funding source for so many people. Not only these are urban counties, but for sure our rural counties. And CDBG seems to be fairly stable and will get put back into the budget where the president had zeroed it out. The home program is a little less stable for the issues of money not being able to be expended, the difficulty of using it and all of that has put it kind of on the chopping block, and the appropriations folks do have concerns with it. Will it totally go away? It doesn't sound like it, but it may take another hit. One of the things that came out of our last meeting on Monday is that with the tax credit program that helps provide the funding for our affordable housing, that is currently in the big beautiful bill and has been made permanent starting in 2026. They have lowered some thresholds to make the tax credit funding more usable and more accessible and even more funding. So that is that's really good for our affordable housing, because that's a major piece of our funding that we then leverage the county funds. So, but again, it is very important that we continue these advocacy work. We stay in touch on a daily basis up there. Your national and state agencies, your advocacy groups, we've got to stay engaged and pushing for these funds to continue to be there. I don't have to tell everybody the importance of the funds that we've got. So again, anything that you guys, that housing related, community development and everything else that you hear, please funnel it to me so I can get it to our policy director and we can get it to the appropriate staff members at HUD, as well as the congressional delegations, that we can start asking for things that we need to push and all of that. And the collaborative effort. One person may hear something, somebody else hears something, and you can pull them together and put that forward and use that for our advocacy piece. So 2025 for the county, we just approved our consolidated plan Tuesday at the board. I think we got $525 more in CDBG. We lost about 1%, about $10,000 or $12,000 in our home funds. We did lose 5% of our ESG funds, but they are still there. We will be submitting that plan within the next couple of weeks to move forward to see next steps. One of the things that I have also talked to people about is we have not seen any changes to our agreements or been provided anything on needing to change the consolidated plan or what's coming down the pike in our new agreements. I know I've heard the CoC agreements have changed. There's new language in it. We have not been provided any of that as we move forward. So we'll be submitting our plan. They may send it back to us and tell us that we've got to make changes to it. And or when we actually get the grant agreement, what that wording says. So there's still some iffiness on our plan as well as our agreement as we go. So stay tuned for that and be paying attention to the CoC agreement when it gets here, or I believe it's already here. of those changes that will be being made. Again, anything drastic, let's push it up the hill and get it to the folks and see if there's changes that we can do if we need to. That's my report for the county. You know, since we're the federal folks, that's our report from the county side of the house.
Okay, thank you, Joe. We're going to go with Arrow. I see your hand up, then Amy, and then Kathleen. Arrow.
So I just wanted to touch on a little bit on the other side too, and this came up at Florida League, at the CoC League of Cities today too. So the state is for this next legislative session looking at 5 different options for potentially reforming property taxes. Could have varying implications. From my understanding, I heard today that the Florida League of Cities has actually done kind of an evaluation on every jurisdiction in the state on what the impacts are, like how much of their funding that includes and so forth. But they're asking that kind of as that basis point for providing some more local information to our legislators on what those impacts would mean kind of on the ground level for those. They're also potentially looking at eliminating or changing what they can be used for the tourism taxes. The gentleman that spoke today is from the other side of the bridge. He equated that amount of tax revenue, which a lot of it's generated from tourists that come to this area, as $2,000 per household additional that would need to be paid in taxes to offset if that money went away. So local government's kind of stuck between the rock and the hard place, trying to see what's going to happen with that too. There was a business rental tax that was changed this year, an exemption in the state statute that I think either got signed by the governor or is on his desk to sign. And that was, I think, $900 million in reduced revenue into the state. Talking to the gentleman today, it sounds like that comes through as a portion of our local option sales tax that we get in Pinellas County. So there may be some local implications to that tax going away as well.
Thank you, Arrow. Kathleen.
Yeah, I had a question as Joe was speaking about our need for advocacy and that they were communicating with their representatives and needing to be a collaborative effort. Can people, it would be ideal if people involved in our joint funders and providers copied Sherry maybe with any of your advocacy letters, that we can be kept aware of what you're sending and how you're communicating so that we can all be on the same page. I mean, not to duplicate but I think it's good to know that we have a continuous beat of advocacy and what people are highlighting as the big concerns. So that would be an ask if you could do that. And then the other question I had was, so Joe referenced some new language in the CoC agreements, or he's heard that. Sherry, do you have anything to add about that?
So we just also received those as well, and we're going through it. The things that we're noticing so far, I mean, we're still going through it, but what we're noticing so far is changes to gender identity and gender collection, that sort of thing, and also funding, making sure that funds are available to faith-based organizations. Those are the 2 main things so far, but we're still going through.
They do want funds to be available to faith-based.
Mm-hmm.
Okay.
April, the other thing I was going to say that I forgot earlier is just that our experience with the Job Corps conversation really reminded us how under fire our representatives are. And Sherry and I were talking about this the other day, that we had spoken with Moody and Scott and others at the beginning of some of the Job Corps conversations, kept our lobbyists abreast on a daily basis of what was happening on the ground and what that meant to the students. And then in an exasperated plea one day, Mayor said, get them on the phone. We need to talk about this again. And all of our representatives were very surprised that it had not been fixed, solved. They said things like, is that still going on? And so it was really a good reminder for us that our lobbyist continues to say to us, like, it is like we're in an ER triaging every gunshot possible all day, every day. And so we have to keep bringing issues up over and over again because the zone is flooded, right? So they're not tracking whether this thing is still going on. And if it's not on their mind, they think it's been resolved. And so I just wanted to share that because we found that is kind of a lesson learned around the Job Corps thing, that even though we were providing daily updates, that it had kind of gone from front of mind for them. And so I think that's a helpful tip for us.
Mm-hmm. I agree. Sherry.
Yeah, I would add to that even, speaking with our own, with the trade association, Florida Coalition and Homelessness, so all the COCs in the state of Florida, and we know Job Corps affects nationwide. But when we were talking even to our own folks, there are 2 other sites in the state of Florida besides what's in St. Pete, and still getting information back of, oh, well, we can offer some career source here. Career source can take care of it. That is not the issue. This is about people are going, and it's not just St. Pete. So even educating people who are in our own circle about the impact of what Job Corps is and what can lead to that homelessness. But the other thing I want to say, I know Arrow had mentioned, the continuing resolution that continues on through 2025, into 2026. Job Corps is a great example of this, and we're going to see this more and more, I have no doubt. We've had federal funding freezes. They come out of nowhere. So even though legally Congress appropriates the funds and they're supposed to go out, we're in a different world where we can't rely on that just because it's stated or, we have the contract, that it won't be pulled at any moment. So that's what we're talking about internally too, is like, well, what happens if, and also keeping ourselves from staying still and thinking, well, we can't hire, or we have to keep moving or else we die. That is, you just have to. So it's like, yes, and still being aware of the politics that are going on that can affect us at any moment without any.
I agree, Sherry, and that was beautifully said. Karen.
Yeah, I just wanted to provide an update. I know Joe spoke on the federal funding that's coming into the county through his department, but right now, the funding that comes through the human services side is remaining static. So we have not received any word of any cuts from SAMHSA yet. Department of Justice, HRSA, we're watching all of those very closely, but right now those are remaining as is. I will say that we had our budget meetings last week. I think most of the departments finished. I think they're just waiting on the sheriff's budget. But at the start, as far as the county, we're 17.4 million upside down with what is currently budgeted. So no cuts have been made. Excuse me, no cuts have been made yet. But every department was required to submit a flat budget with recommended cuts moving forward. And so those discussions will be occurring in August with the BCC and county administration. So we're kind of watching and waiting to see what may get cut from our budgets. But right now we're flat and as is moving forward. So the current investments that we have for homeless services, healthcare services, behavioral health, we were able to move those at least across the first finish line, but we still have 2 months to go.
So Karen, just as clarification, so when you say it's flat and then you say it's 17 million upside down, like reconcile that for me.
Departments had to submit a flat or under budget. And so with that, the county in general is still $17.4 million upside down. There's a gap. And that's excluding the sheriff's budget.
Yeah, which, again, I think it's important for people to know, right? Like the Pinellas County's budget is just under $1 billion, and, the sheriff's department budget is somewhere in the neighborhood of 47% of that. So that, it's important for everybody to understand what that means, right? Except for the sheriff's budget, which is 47% of the entire budget, is pretty, is pretty meaningful as far as I'm concerned. So other funding partners that can lend us any information? I am curious about, I mean, it seems that we've gotten a lot of the perspective from, kind of the leadership that's on the call. Is what are you also hearing would be my curiosity. What are you also hearing? I know I hear a lot of stuff every single day. It's what are you also hearing from the people who are closer to some of these decision makers that you need to be watching, and that you need to be, again, just watching. As Karen said, they're watching things every single day, but is there something that you're hearing you need to be watching more closely? Anything like that?
I think it's definitely at federal level, the House and Senate budget discussions that are kicking off. I think mid-July, that's going to be a critical part. And then for the state, keeping up with this task force that's been put together to evaluate property tax reform. I think those are two big key areas, because if there's cuts on one or the other, there's gonna be issues. If there's cuts to both, we're really in deep water with that. So
yeah, so I do want to hear from our providers, and in particular any impact that people are concerned about, are already experiencing, emails that people are receiving, and concerns from our providers. No concerns from our providers.
I can speak on the educational side.
Yeah, please do.
For Pinellas County Schools.
Okay.
Right now, we're funded for the 25-26 school year, but as the new skinny budget has been passed, the funding for McKinney-Vento is not allocated. It looks like it's going into, as it stands right now, a block grant. And there's over 18 educational programs that have gone into that, and we're not included. So we're just sitting tight. I know they're advocating in the House and in the Senate for us. They're passing a new bipartisan bill. They're trying to get passed, which would keep our McKinney-Vento protections in place. But as of right now, we're just waiting.
And that's really for fiscal year 27, not
yes.
Yes, right? Fiscal year 27.
26, I'm sorry.
Oh, for fiscal year 26.
for us.
Okay. Okay. Okay, other providers.
So I'll go. This is Judith with St. Vincent de Paul Cares, and we, on a high note, have not seen any cuts on the veteran side. So that funding has stayed consistent. We were in DC, the Secretary of Veterans Affairs was there, and really there's no indication that we're going to see cuts there. And it looks like he's committed to an investment in suicide prevention. Now, I would say on the CoC side, we're in 22, or the HUD side, we're in 22 counties, and I think there's fear of that all over.
Yeah. Okay. Any other providers with concerns? I will say, oh, Mickey, go ahead, Mickey.
So just a quick, and I don't know if it's really a concern, but I did receive from the National Alliance to End Homelessness, and I'll put it in the chat in a moment, a link of the impact, and it talks about, on the CoCs and HMIS and the office at the federal level that collects all that data as well from the CoCs. So I didn't know if anyone representative of the, HLA proper, aside from our council here, had more information about that. I've heard about, housing first not being a priority, and, what's the impact of that on our community as well. I'll put the link in the chat.
So there are proposals out there that float, and I hope you all are taking those seriously. I'm taking them seriously. They're just not words anymore. But housing first, looking at equity in housing. We've had conversations around internally around emergency shelter and transgendered individuals and their rights, right? And but the other concern, so a huge thing, just the CoC program and its very existence right now is the talk is turning it into a state block grant, combining it with housing opportunities for persons with AIDS and HOPWA, and then putting that into an ESG style, like shorter term with 2-year assistance limits into state block grants. And when we look at the way that we collect data through HMIS, that we are driven by data, that we can make local decisions, and we have permanent supportive housing. And by the way, the word permanent can be misleading to a lot of folks too. So just saying supportive housing, where people will go with disabilities or who are older and who need those supports into assisted living facilities, hospitals, places where there are no beds and that are more expensive and that are not as supportive. Just working through that language a little bit better. So kind of like going back to that Job Corps situation, educating and showing what the real impact is here on the ground. But that's the talk right now.
So I guess, Sherry, question back is kind of maybe not this meeting, but maybe future one, the HLA board proper, what's happening with HLA board kind of proper and their vision as well of moving forward, aside from the CoC for the HLA.
For the HLA, I mean, right now we're working on, I don't know. I don't know how to answer that very well right now. But right now I've been working with Kathleen and with with the board members, executive committee on some advocacy efforts. I've been sending out emails and calls to get us on the calendar to meet with local representatives and senators when they come back in district, and hopefully would love to have some site visits scheduled of PSH programs so that people can walk through and see in their own districts what's being provided and what the alternative would be, which would not be good.
Okay, thanks.
Mm-hmm.
Yeah, we don't have, Kevin's not here. I think Dama is on. Dama might be able to speak to it, but I certainly know that the majority of this group no doubt has heard that, that there is a proposal afoot, right, to reduce permanent supported housing by, close to a couple 100,000 permanent supported housing units. I don't know if Kevin and others have done an analysis on what that means for Pinellas County, specifically how many units that would be. But, again, where that is, what our advocacy role can be relative to permanent supported housing is going to be critical. Sandra, I see that your hand is up.
Yeah, but was Dama, were you going to respond?
I was just
Go ahead.
say that I can't give numbers. I mean, Kevin would need to do that. But I mean, the impact would be catastrophic. The level of severe and persistent mental illness, which primarily is what BOLI has, right, is very, very extensive. High ACE scores. I think on average, most of the people that we have housed have spent at least 3 years homeless. And the other piece is the degree of medical conditions that are also happening that we're seeing. I mean, honestly, we could probably operate 2 ALFs under BOLI right now. And there really are not viable options for these individuals. So we're, attacking home health care or like a home health aid, all sorts of other viable options, right, to try to keep them remained housed. Because there really isn't a place for them to go with their physical condition in addition to their severe and persistent mental illness. They'd never make it in a traditional nursing home or ALF. And, the number of individuals that I'm just going to talk a little bit about mental health, right, that they're not individuals that are actively making any threats to harm themselves or others. They're not necessarily destroying any sort of property. They're not getting into any physical altercations, but there are arguments constantly between them and the other residents. There is also arguments with people that are not there, where they're having visual and auditory hallucinations. We even have some that are having tactile hallucinations, talking about their skin burning, chemicals, coming through vents, and their eyes are burning. Those are individuals that, if you can't get a real clear picture of what I just said, I will take you on a tour personally and let you see firsthand. Those individuals will not survive in a shelter. They will not survive on the street. It'll be a revolving door to jail and CSU.
So Dana, with that, I do want to hear from Sandra, but with that, again, just not just to you, but to the whole group, is really thinking through contingency planning. Is really, it does sound to me like, based on everything that's been communicated, even here in particular from Joe and others, that for fiscal year, regardless of when your fiscal year begins, either July 1 or October 1, fiscal year 26, that there may not be a significant change at the state level, maybe even not at the federal level, but moving into fiscal year 27, that we need to be ahead of the game, is all I'm trying to figure out, is around the contingency planning. If we're 17 million upside down already in the county, who's going to be doing the strategy around what the contingency planning is? For example, if a notice comes out that permanent supported housing is no longer funded. And I do think, to Sherry's point earlier, this idea that we can just relax on, well, currently what it says in writing, right? Congress has approved, somebody else has approved. That means that we can rest. It doesn't necessarily mean that, as we've seen with Job Corps and some other programs. And so really it's contingency planning that I think ultimately we're going to need to get to, if in fact we're safe for the next 6 months. Let's just say, what contingency planning are we thinking through?
Well, April, I would say contingency planning, right? I think BOLI is the contingency planning for all the other homeless services in the CoC, right? When it doesn't work there, right, we don't get somebody that's brand new, it's never been to Safe Harbor, never been to Pinellas Hope. In fact, they've usually been to many of them on and off for several years. And it hasn't worked anywhere, right? So they're really, hopefully Kevin doesn't get mad at me, but there is no contingency plan for where the majority of this population will go. We are that contingency plan.
Yeah, when I think about BOLI, for example, and again, this is not a conversation that I've had with Kevin, so this is just April Lott speaking, is, when I think about BOLI and all the housing that BOLI has, and quite frankly, all of the affordable housing that is needed in Pinellas County, that if permanent supported housing went away, that BOLI could flip all of its housing to affordable housing and survive as an entity. However, with that shift, right, all the people that are currently missioned and prioritized to be served by BOLI would now not have anywhere to go, right? So it's that kind of contingency planning that, as a system of care that I'm referencing. Sandra, and then Arrow.
Hi, thank you. I think, so when you said contingency plan, April, I got like this pit in my stomach, because I don't know that there is one that's even reasonable given the volume of people who live in PSH. And, when these conversations all start, just as a frame of reference for those who don't know me, I work with Carrefour Supportive Housing. We're a nonprofit developer and develop permanent supportive housing across the state. And our budget, our effectiveness and success is based on CoC funding and DCF funding for supportive housing for people with SPMI. but the bulk of our dollars come from the CoC. So if they move PSH into ESG, they're pretty much eliminating PSH entirely because it becomes time limited for up to 2 years. We have people who've been living in some of our communities for over 15, 20 years and are only housed still because of the support services and the rental assistance dollars that come either from the CoC or from the local housing authorities. So they're talking in these, from my understanding, is these are all going to be eliminated merged into the ESG block grant and managed by the state. So that means that folks who will, they'll leave, they'll have to go somewhere, and there's nowhere for them to go because the only reason they're staying housed is because they're in a supportive housing setting, which is a light touch, low cost and highly effective. And I don't need to give you all the sales pitch, you know that. A provision of services for folks with complex needs and who are formerly homeless. So I think in terms of how we frame, I can't even imagine if they completely eliminate PSH, but it does align with the narratives of people not living off the government forever. If the whole, whole change from the perspective of people are homeless because of their own choices, not because of lack of affordable housing. So I think it is something that we do need to think about, both not just in this CoC, but as a state, like how do we negate the potential impact? Because I don't know who's going to be able to pay for the services and or the rental assistance needed, because most people living on disability can't afford to pay rent. Even we're a low threshold affordable housing developer, and without assistance, people who are living on a disability check can't afford our minimum income requirement, and our minimum income requirement at Carrefour is far less than most affordable housing developers. And similar to Boley, I mean, we could always just, make our buildings 100% affordable and keep the buildings intact because we own the buildings. We own them, we're on the hook for them. But that means that the people we're committed to serving, which for us is over 5,000 people across the state, is a loss. And we're mission driven. So that's not that we're looking and scrambling and getting on all these calls and trying to figure it out. But I think much like the Job Corps, I was caught off. I was not aware of what was happening with Job Corps. And I think that that's something that I think people need to realize that some CoC contracts are sunsetting as early as February 2026. So it's not next year, it's like months before this all happens. So I'm not offering any words of wisdom as much as these are our concerns as a provider. And I really at a loss of how to replace PSH and and we get highly creative around funding, and we can layer it with some rapid rehousing. We can do all of that kinds of stuff. But these folks that live in our PSH are long-term participants who deserve that housing.
Thank you, Sandra. Arrow.
I was just thinking, wonder if making sure to educate our state legislators on if this becomes state block grant, what that looks like to the state and what their responsibilities would be, and why that funding gap would still be needed to be filled if it's 50% of what the federal government's funding now, and maybe even some tours of facilities. Like Dama was mentioning, make it real for them. What is their step going to be at the state level, especially if they're looking at property tax reform at the same time, right? So they're looking to cut revenue sources, and now they've got this other responsibility that has a 50% gap coming to them. And that's just in that one realm. We heard from education too. That's another realm that could be potentially on their budget plate. So I'm just thinking about legislative things. I think we got to make that real for them too, like what that looks like if it comes to them on that level.
I agree. I will say at the state level, we kind of breezed over it at the very beginning that, the budget, while it has been, placed on the desk, so to speak, it's not yet with the governor. And, the governor has, alluded to, on a couple of occasions, his veto intentions. I don't know if those have changed, and perhaps they have, but the budget is nonetheless several $billions lighter than it has been in previous years. Some of the stuff that I'm hearing is, kind of through this, Department of the DOGE kind of governmental efficiency kind of stuff that, for example, in this state's budget, and maybe Celeste can speak to some of this, is, there's a cut of about 1,000 to 1,500 positions in the kind of health and human services, which of course includes the Department of Children and Families and others. I don't know what the impact is of at the state level of the loss of that where they're starting is internally. So 1,000 positions being cut to include hundreds from the Department of Children and Families. Erica, who has been our assistant secretary at the Department of Children and Families, who really had her hands around mental health and substance abuse and homeless services, will be vacating her position. Our Department of Children and Families secretary, right, was moved to ACA. I mean, there's quite a bit of change that is happening at the state level, in addition to, even if the budget is exactly the way it is right now, there's no veto of anything. It is still pretty impactful around some of the cuts, in particular around support from within, like departments. Does anybody have any additional information? I was thinking of Celeste. Like, Celeste, have you heard anything about the cuts that are coming in staff and positions to the department? I don't know if Celeste has stepped away from her computer. In any case, it's those kinds of things that I'm curious about. I've spoken to our trade association and to the managing entity and a couple other places to say, what do we think the impact to, statewide, the loss of 1,500 positions from within these various departments will have on efficiency, that kind of thing. And I'm not really getting much other than, kind of tea leaves kind of thing. Like, they're not hearing much about what that will mean. I will say from a mental health standpoint that the budget as it stands right now that went to the governor, absent veto power, that mental health and substance abuse has remained intact. Some pretty significant funding, about $7 million that was in the budget last year to support kind of CCBHC implementation and moving towards, a more efficient model relative to behavioral health, was cut from the budget. So that will be somewhat impactful statewide. But in general, what is happening in the budget relative to mental health is the kind of this oversight to our managing entities, and really that's who's under, and the legislative language is, this is not about providers, this is about government efficiency. It is our government that has gotten too big. It is our government that has too many staffs, it are staff members and duplication within. And so really it's our government that's going to be taking the hit. And so I haven't heard any of that from any of you. But, is there a fear or concern, for example, Arrow, that you would be losing positions within the city of Largo, within Pinellas County, within the city of St. Pete, people who are clearly doing the work? Is there any concern there?
I think there's always concern. I mean, our role, and I don't have a private office here. I have open walls right now, so I'm going to be careful with what I'm saying too. But at this point, I mean, I think we're really waiting to see what comes with that federal budget. How big is big on those, and obviously at the city too, with the property tax reform. I think those are the two big key things. We don't want to pull, overreact ahead of time, but we know it's out there and we're, being vigilant with it. So I want to ask too, I think you said Lieutenant Hayes is on the call. I'm just thinking about, he will probably say, the jail ends up being the biggest mental health facility in the jurisdiction. What happens if all these close? Like, from the sheriff's perspective, what does that mean to their impacts? I mean, I think you guys are already at capacity, right, Lieutenant Hayes?
So yeah, I mean, the jail already runs at capacity or over capacity every single day. Obviously you guys, without getting into it, you guys are understanding why the jails are also running a little bit higher right now, as well. The foreshadowing and trying to look out there to see what the potential impact, I don't know. I haven't been a part of any discussions as of recent related to anything like that, but obviously, I got 4 pages of notes here that I've been taking down with everybody's concerns with budgets being slashed, and it all comes down to housing being in jeopardy. Obviously that puts our agency and the jail specifically at a great level of concern with the amount of implications and impacts that the jail will take on if these people don't have their permanent stable housing, because obviously they're going to bounce from the jail to the CSUs to the streets. So, that's going to be a problem. I don't have anything specific to provide though.
And I think maybe, obviously there's, different service level for sure on permanent supportive housing versus a night in jail. But I mean, it is not cost effective and it does not help anybody. It doesn't help society. It definitely doesn't help that individual to have that be their mental health solution, so to speak. So I think that might be another component for our legislators to understand, like, without these, this is where it's going to unfortunately end up. And you guys are already at capacity, and it's not an outcome for anybody that, it's not improving anybody's outcome.
Celeste is here.
I apologize. I was dealing with a TCF case. Imagine that. Did you need me? Did you want to ask me something?
Yeah, just the budget as it stands right now that's gone to the governor that has not yet been signed, and certainly lots of things, if not all things, could change through vetoes. The narrative is that there's somewhere between 1,000 and 1,500 positions that have been cut, across kind of, health and human services, to include the Department of Children and Families and others. What are you hearing relative to that? Do you have concerns? Are there positions that, that we should be aware of that currently have, I'm assuming all positions have critical role and function. And so, I did hear, because I've been trying to get my hands around what that might mean locally and across the state is, that the majority of them might be vacancies as opposed to actual people in positions. And that they're just simply going to remove any position that's been vacant for a year or longer, and that's going to be the majority of the positions. Is that what you're hearing as well?
Yes, and April, you've been working with me for so many years. I live in concern, right? Pretty much. But yeah, seriously, there's the majority is already positions that have been vacant that they just will not be filled. My concern is because they're hitting up mental health. They're hitting up the substance abuse mental health department. So that's always a concern. Because we know the criticalness of mental health in this communities in Florida, right? But the good news is, yes, it's about the vacant position. My concern is what happens, say, if, just as an example, I'm not mental health, but if I leave, do they not fill? You see what I mean? So if we lose more people in the positions currently, are they not going to be able to be filled due to the budgetary restrictions? I haven't heard one way or the other. I did pose that question. I'm still awaiting an answer. But yeah, that's the primary concerns. But you're absolutely right in what you said. It really won't affect it in the sense that the people weren't here anyway. The position's been vacant for quite some time.
Okay. Blossom, I know that you're on as well. Can you talk to us about what's happening with the Veterans Administration? Are there still concerns about position loss there? How's that impacting services, you know, those kinds of things?
Hi, yes, we haven't had any like active positions pulled from us. We have had one under homeless. It's our Southern Coordinated Entry Specialist. When she retired, they didn't rehire. So we're having some of that go on. And we were able to make it work and cover. As far as the grants, there hasn't been any grants cut in any of our GPDs or any of our contract shelters. So far, so good. News on the VA front.
Good. Okay. Thank you. All right. Anyone else? I will say that I saw, Jeannie come on from the Juvenile Welfare Board. The Juvenile Welfare Board did reduce funding for housing, rapid rehousing for families. So as of March of 2026, the funding that has been available for rapid rehousing for families from the Juvenile Welfare Board will expire, will sunset, will be done. And, I am fearful about what that will mean. JWB stepped in when there was a crisis relative to family homelessness, which was greatly impactful and appreciative. We have, hundreds, in fact, of children and their families who are being housed and stably housed through that program. And I think the housing crisis has gotten worse, and as we've heard here, perhaps may get even worse. But it was certainly made worse by the hurricanes and the impact of the homes that were damaged through the hurricanes. In any case, so there is going to be some real impact locally on on programs as people are anticipating the reduction, for example, in sales tax and other things, and really just trying to tighten budgets and tighten belts. So. All right, anyone else? I don't know whether the takeaway from the conversation that, we're good for a period of time, or that we, really need to be doing a whole lot more talking and advocacy around contingency planning. I do think a lot of things are going to move to state control, so to speak, and that means states will have to budget it, and if states can't, that really hard decisions will get made. For example, at a BOLI, maybe everybody who currently qualifies for BOLI wouldn't continue to qualify, and it would be really kind of the sickest of the sick who would continue to qualify, but a whole bunch of people that currently qualify wouldn't. I use language that I've heard recently from a CEO who's retiring, which is, I just don't want to make the decision about which kids get to eat. I do think there's going to come down to, kind of hard decisions that are going to have to be made. And I'm hoping that our voice is going to be a part of, and we're going to have to narrow our advocacy. It just simply can't be, we need everybody to continue funding everything that they're funding right now. Like, we're going to have to get more helpful to our funding and policy partners on what they need to be funding, because it's just simply not going to be an option that they can continue to fund everything that they're currently funding now. Kathleen and then Amy.
I'm just curious. I appreciate people being on here on our funders from Largo and St. Pete and the county. Do you have any kind of a cohort or anything that includes Clearwater on your discussions of concerns? I mean, I don't think the Clearwater representation has been there in a funders only meeting. So I'm just wondering if there's are there other meetings going on where Clearwater is involved that I'm not aware of?
We do meet monthly or every other month with kind of jurisdictions. Usually like the CDBG home jurisdictions meet together, and Clearwater is on that. I think they have 3 or 4 staff
Who's the
members on
representative? Because we don't have housing. It used to be Denise Sanderson, Housing and Economic Development. Is it Jesus Nino, our CRA director?
So on that call, usually we have Danya Perez, who recently joined Funders Council, and then we've got Terry Malcolm Smith, who oversees the state housing program, I think, for the city, and then there's a couple other staff that vary who's on the call.
Maybe a guy named Justin or
Sure.
something. But
well, there's Dylan. Dylan's sometimes on those, but usually it's kind of the operational folks.
Kara Grande, one of the staff.
Oh, Kara, yeah.
3 or 4 of their staff are there. Dylan has been there once or twice. You know, that is, I think that meeting kind of came out of the end of COVID, and it gives us, we were on a weekly basis there for a long period of time, and we've kind of stretched it out to, I think we're at monthly now, or it may be bi-monthly, but there is that opportunity for the 4 of us like-minded with the same funding sources to get together and have those conversations and bounce things off of each other.
Okay.
We also talk about like program term changes, what programs are rolling out. Like we're all kind of operating disaster programs right now, so kind of the status of those programs, what they're seeing as needs, and that kind of stuff too. So.
And then, isn't our other entitlement Pinellas Park? Do they participate?
Yeah, she just did. So I don't know if you all got the news. We received it from Lizzie St. Pierre, but Tammy Hillier passed away recently. She was on Funders Council prior to, she gave the update in our last meeting. Lizzie St. Pierre joined Funders Council now as Pinellas Park's representative. But she did let us know that, unfortunately, about Tammy, who we worked with very closely for years. So I'm really sad about that. But yeah, so they participate in those jurisdiction meetings now too.
Okay. Thanks, Carol.
Okay, Michael.
Yeah, just to be quick, and because I know we're sort of ending this part of the discussion, but I thought back to the meeting, April, you, myself, and Kip, who is now with Met Min, who's on the call too, had with Representative Anderson related to insurance and the cost of insurance for providers, because that was a huge concern that Kevin brought up as well, in terms of, you know, all the insurance for BOLI too. This is, since there hasn't been action, this is going to be a real issue coming up into, I'm going to just assume the next legislative session. And I'm not sure what that impact's going to look like, but that needs to be on everybody's radar as well, because, you know, it's gonna potentially force some of us to rethink how we're doing this. And you know, April, we had out of nowhere a $70,000 wind bill that came up on our one property. So it's, you know, this is something else that we're not talking about yet, but thinking about funding and all of this, we're going to really need to make that part of our discussion going forward.
I agree. Arrow.
Hey, Joe, I know with the disaster money that there's some planning and admin money. Is maybe there's some potential for kind of like consultation for like, or in general for nonprofits, what types of things would give them insurance discounts, not just for property insurance, but liability, this, that, and the other, with a set of recommendations that could help form what types of things could be done to help reduce. I mean, obviously there's just the cost overall, but
I had that pulled up just a minute ago and closed it. So hang on just a second. Oh, that's the wrong one. There is not in the disaster action plan. There is not going to be funding at the moment for those activities that we just talked about, operational and all of that. It's not going to be there in the overall disaster funding. again, with that CDBG-DR funding, it has got to have that major tieback or direct or indirect tieback to the hurricane. So that, the operational, that type stuff. Now, I will say, in the action plan that was submitted, $598 million are going toward housing to get folks back in their houses and get stable housing. But as part of that, there's also $10 million set aside for nonprofits. That nonprofit is for stabilization, mitigation, stabilization of our nonprofits, because we know we've got to have our nonprofits to be able to serve everybody that we do. As I said, there's 10 million there. It would do any repairs that are still out there, some mitigation, some hardening. I say all of that to say that none of that has been set in policy yet. One of the things that's going to be coming forward is the action plan is submitted. The administration's point is people first. That 598 million is going to be the first thing that hits the street. Sometime in the spring or summer of next year, we will begin looking at that nonprofit stuff and begin writing the policies and procedures. We've got that overall big picture view of we need to help our nonprofits. Then we will begin in the late winter, early next year of trying to write that policies and procedures to be able to help our nonprofits. You'll hear us probably come out and say, how do we need to help you with this funding toward the hurricanes? But there is 10 million set aside for nonprofit help there. So that is something beginning of the year, probably you will begin hearing more about that.
Amy.
April, I just dropped our link for CDBG-DR into the chat too. We have public comment open until Monday, so June 23rd. And I think it's really important for us to hear from providers about what they need. Right now, we have $6 million programmed in for public services. But I was a little surprised. We didn't get a lot of comment at either one of the hearings. And I guess that was the other thing I really wanted to say. I've said before that, whenever we are facing cuts that impact vulnerable people or the poorest of our community, we don't usually see people come out with pitchforks and an organized voice. And if everybody wants to keep funding, that's really what's needed. When the governor cut arts funding last year, the artists sure came to council meetings and got 100% of that money backfilled. We have a budget gap too, just like Karen, but closed mouths don't get fed. And so I just really encourage folks to come up with a plan and use your voice, because these implications for our most vulnerable people are real. And I'm not seeing folks helping their elected officials understand what that means, that babies are sleeping on the street, that I mean, everybody on this call certainly knows what it means, but we've got to paint that picture so folks understand the implications of that.
Sandra.
I was just thinking on the same lines as Amy. I think I'm not currently a recipient of funds in this CoC or county, but as a statewide, I'm part of a statewide coalition, and these are similar conversations that are happening across the state. And I think we're almost immobilized because of the impact of what is ahead of us. And I really appreciate, April, what you were talking about before about what's our contingency plan. And perhaps that's kind of aligned with Amy in thinking about we do need to have a voice, and we need to speak the stories of the people we serve, as Dima eloquently described the people that she's serving, and where are they going to end up. And I'm wondering, Not that anyone wants to go to another work group or another subcommittee meeting or any of that, but I do think it would be helpful from all the different perspectives of the way all of these services that touch vulnerable people are funded, to get those folks around a table and strategize, because I don't know that people really understand. Not these people on the screen. We all get it, right? But the funders and the legislation and people who are making these decisions understand the complexity of layering all of these funds. And then Michael added a whole new one, which is insurance, which is another big deal. But this all hits nonprofits harder, not just cutting the service element, but all of the layering of funding that come in from a variety of different sources. And I think it would be a good opportunity to have to create the narrative based on factual numbers and the people that are impacted by those numbers. And I work as part of the Florida Supportive Housing Coalition. We're happy to be involved in any way we can. It's something that we have been looking at as well, but just as a way of really kind of putting it out there. We're not just talking about merging programs. We're talking about ending programs, and this is what it means for us.
I agree, Sandra. Sherry.
Yeah, piggybacking off that, the stories matter, and also making sure not only, educating all the people adjacent, or bringing on allies who are not just in our bubbles, because you have somebody from the Chamber of Commerce, you have business, you have healthcare, but think of veterans, think of the elderly population. And businesses, there are folks who are groups that are more receptive, who will be received in a different way than social service providers. And so to keep that in mind, but also what I was saying earlier about reaching out to people and educating, we're having a conversation around using TikTok to, reach out because that's where people are, and they're not, they're not reading these white papers and things like that. And so, because there are so many, because this affects everyone. It can't, or it could, or they know somebody that it could affect. And so, making sure that people hear those stories is important.
Yeah, it does seem, curious to me, like the Job Corps issue, right, for example, has not resolved, just to be clear.
It has
not resolved, right? So, there's 250, 16 to 24-year-old kids that currently live at the Pinellas County Job Corps.
They were called back after being sent out. Yes.
Yes, who were called back and who, we are under some kind of injunction or some kind of stay. I don't know, right, what the likelihood is that injunction or that stay will, be forevermore. I believe that is temporary. And so there will be, somewhere in the neighborhood of 125 to 250 kids who will need to go somewhere. That I think everybody on the call, including Lieutenant Hayes, would agree that a 16, 17, 18, 19-year-old even is not best suited for safe harbor. These are very vulnerable, highly vulnerable children. Many of us on this call, sat over at Job Corps, hearing their stories, listening to them talk about dying by suicide and a variety of other things. And so now we have a stay, or we have some kind of injunction in place. And it feels to me as if we've moved on to something else, and we are no longer contingency planning for when that stay or when that injunction is lifted. And I want to be as optimistic as the next person. I really do. I just know that when these things tend to happen is at 5 o'clock on a Friday.
Mm-hmm.
I'm going to get the call that someone's going to be telling me, right, like we've got 125 kids hitting the street, and I just would prefer to have I don't know, a game plan going into whatever Friday at 5 o'clock it's going to be. So it's just that kind of thing. And again, I just want to repeat myself. I think that we have to get better at helping our funding and policy partners with what the priorities will be. I think it is absurd to think, for any of us to think, that through advocacy, all things will continue to be funded. It is not going to happen. And so if all things can't be funded, we need to help our policy and funding partners with the priorities of what will be funded. And if cost shifting can happen, right, to use CDBG, disaster recovery, or if any cost shifting can happen for a period of time, great. We need to be thinking that stuff through too. But it just feels to me like just simply saying, that we're going to advocate that everything continue to be fully funded, I think is naive. Arrow.
I was gonna say with that Job Corps thing, I was following along with the stories, and I may have missed it, and I'm pretty well ingrained in these conversations and so forth. I didn't feel like the article specifically called out that they live at Job Corps. Is that correct? That they live there?
Yes.
Because it talked about them being vulnerable and them getting workforce training, but I feel like the articles in the paper did not hit home on that. So if there is anything else maybe that can be shared with the newspaper, if they're writing continuing stories on that, maybe really to hit home on that component. Like, this is where they're housed. If this closes, like you said, there is no immediate place for these folks to go other than the street. So I just gonna put that on that.
We did, through that process, it was interesting to me through the process originally when we had gained some momentum, believing that it was imminent, the Salvation Army, all of a sudden there were 14 beds or something with the Salvation Army, which I never even knew were on the list, by the way. And even Family Resources, came forward to say, that they would, especially for our little or younger ones, our 16, 17-year-old ones that, can't even rent a hotel room, for example, or, but they had some beds that they were going to put online. Certainly not enough. But in any case, it is coming. It is still coming. Or at least that's what I believe, is that it is still coming. If we've bought ourselves some time, what I want to say, which should always be the strategy in crisis, is that you're buying yourself time. I think we bought some time with some of these things, but I don't think we're using our time wisely. So I think we're relaxing a little bit, and then the crisis is going to hit, and then we're going to now all scurry to try to figure out the crisis, when this is the time right now to be figuring out what we would be doing I don't know if it's if or when this occurs. Kathleen. I'm sorry, go ahead, Garrett.
So with this too, you're talking about priorities and so forth. Like, for example, right now we have prioritization for family shelters based on, SPDAT scores and so forth. But because there's not a wait list for individual shelter, it's not prioritized directly on vulnerability for that. It is for rapid rehousing and so forth. But that may be one of those things, if there were cuts, that has to be done, that it's going to be people that are at the highest vulnerable scale are going to be the ones. The other ones, that's going to be the pool that's going to be left to fend for themselves, so to speak.
That is correct.
I don't know, but
Kathleen.
I just looked at that individual list 2 days ago that came from HLA, and there were 200, I want to say 200 and something numbers of individuals that had a score of 9 or higher that we were looking at for safe haven. So, right, 9 is a very high SPDAT score.
Kathleen. You're on mute. I can't hear you.
I was at that press conference for Job Corps, and Commissioner or Council Member Corey Givens got up, and there was another council member from St. Pete I'm not familiar with that got up and spoken. The narratives were impactful. The reporting has been, questionable, as Arrow said, or someone said about these kids becoming homeless. But what I think we need to, as we plan for the future and further cuts and the rug being pulled out from underneath us and all that, what struck me about that event, that press event down there across from Job Corps was, and the reporting, is this large presence and stepping in an expectation of St. Pete. And so that's a federal building, a federal program that's located in St. Pete. And why do we expect St. Pete is going to come in and come up with the money and fill gaps? Why are we not communicating to the entire group of 24 other municipalities, 23 other municipalities in Pinellas County? They're just off the hook because it's located there. And the surrounding counties. Why didn't they go out and talk to Hillsborough and Pasco and all those other counties that abut and feed into that Job Corps? In fact, there are students from other states that are at Job Corps, at the Pinellas Job Corps. So it really irritates me that there's this expectation of our largest municipality that happens to be really the most generous and compassionate, but whatever. Why do they have to come in solely and be the savior? That's not realistic, and it's not fair. And I think we, as an organization that represents the entire county, need to make sure that these other municipalities are aware and are questioned and need to be informed. We're all in this together, not just because it's located in Pinellas or in St. Pete, whatever. So it just struck me as, and the one council member from St. Pete got up and said something like, well, we're going to think creatively and outside the box and try to, make it happen here. But he didn't allude to, I'm working with my peers throughout the county to do this. So anyway, I just think as we go forward, it's not on St. Pete. It's on all of the municipalities from Tarpon all the way down to, St. Pete Beach and all that. So y'all can correct me if you don't agree.
No, I absolutely agree. I will say that, just for the sake of fairness in the conversation, that, Dominique with the county was very active in, trying to be available and making herself available and those kinds of things.
Yes, those meetings were great for us, but for the decision makers mean, the people with the purse, the electeds need to be,
Agreed. And I have to say, I agree with you wholeheartedly. And I literally asked the question at my first meeting. I'm like, so are these, because it's located in in St. Pete, can we assume that these are all St. Pete residents? And of course it was like, absolutely not. And, on one hand, I'm like, well, St. Pete is the most compassionate and the most generous and the most sensitive to, the issues. And so, I was kind of hoping the answer was going to be yes, right? Because they are problem solvers at their core, and they are absolutely, people that, I want to be on my life raft, right? If I'm going to the streets. But with that said, 250 kids is 250 kids. It's too big and it's too much. So your point, remains the same, which is it's going to take all of us. And if anybody here has heard that Job Corps is just simply going to resolve itself, I want to hear that. Because right now I wait every day, right? I start watching my clock at 4:00 because I'm like, it's going to come at 4:58. And we're all going to be shot out of a cannon trying to get this fixed. Sherry.
On that, of course, we're still trying to talk with Job Corps and Ecker Connects to find out what's going on, because and that has been one of the barriers and challenges. But I wanted to follow up on with Job Corps really required the people who broke it needed to help fix it. More federal coordination would be useful. But let's go on to injunctions. So the temporary restraining orders and talking about contingency planning and how do we continue moving if regardless of what is on paper and what's in our contracts, if it was to be cut tomorrow through some order, if you're like, well, we have the courts. So this is where I'm kind of thinking. So how long does it take something to go through court? Right now, Job Corps is dealing with a week by week. The decision was supposed to be by the 17th, and then it was moved on another week. And then at that point, it could be June 30th. You have to be out, really, because that was the original order. And so just that's what I'm thinking about when I think of contingency planning on that end, as far as like, viability as an organization, because without that, we can't do anything else beyond, for people, and also what people need, of course.
Yeah,
But so how long that takes and how long.
I do think it's important that everybody understand that what the letter says that I have is that it was June 30th.
June 30th.
So June 30th is the day. Nobody will be on payroll past June 30. No child will be able to live at the Job Corps past June 30. There will be nothing past June 30. So
once the injunction's lifted. Yeah.
Yes. Right.
Yeah.
So yes. And what the rule, I guess, is that the youth are supposed to return to the community from which they came. But the two things to that, the majority of these young adults, don't have viable options of returning to, at least not to family, maybe to the community, but not to the family of origin, due to abuse and neglect and other things such as that. But in addition to that, the majority of these individuals are 18 years of age, and they just simply are saying, I won't. You can get me a bus ticket and drop me off at the bus station. I'm not getting on the bus. I'm not going. I simply will go to an emergency shelter that's located here. And as you know, that emergency shelter is most likely going to be Safe Harbor. And so that is not really an emergency shelter, and it's certainly not an emergency shelter designed for young adults. And so,
is Family Resources on this call?
I believe they are.
Okay,
Yes.
Oh, there she is.
Hi, Nicole here. I'm stepping in for Andy today.
I was just curious if you could share a little. I don't know if you all have been involved in this at Job Corps and kind of your role.
Yes. Yeah, absolutely. So I can tell you, I do our compliance, so I can't speak as well to it as Andy does, but I will do my best. We are our St. Pete, Clearwater Shelter, even Bradenton, if it was needed across the bridge, are open to taking youth from Job Corps if needed. We do cap at age 17, so we can take 17-year-olds, 16-year-olds. And typically right now, we always have availability. If one of those shelters is full, we will put one of those youth in another one of the shelters, and we can move them to a closer location as soon as there's a spot if needed. But we've decided we are undergoing some funding changes on July 1, where they are, our state funders being a little more stringent with 30-day stays for youth. But we internally have already made a decision that whatever that looks like for us, for Job Corps youth, we will house them and figure out what's best for them, regardless of time frame. So we are available. Screenings are done over the phone. They can be done by walk-in, but we absolutely have had Job Corps call for a few screenings as well as youth themselves. So we are here.
Great. Now, like to the extent of 125 you could take, or
are you just saying days?
No, how many people? Like
sorry.
If
So
125 people.
Oh yeah, no. So we have each of our 3 shelters has 12 beds in it. And so typically our average census between the shelters, each shelter houses between 7 to 10 youth on any given day. It definitely gets lower sometimes. When school picks back up, it's going to increase because we get truancy court ordered kids. But for the summer, there's a lot more flexibility. But if all of our shelters were empty, you're talking 36 beds total.
And Era, the vast majority of these young people, although I don't have the breakdown specifically, are at that 18 years of age and older. The numbers of 16 and 17-year-olds was a smaller number to begin with. But I do just want to say thank you so much to Family Resources, who really did kind of alleviate some pretty significant concerns about our youngest. And so we appreciate you very much, Nicole.
Absolutely. We are happy to help, truly.
Yeah, thank you.
You're welcome.
April, there is a 17-year-old kid, but she's 16. I think she just turned 17 at Job Corps that I met with. And this little girl thinks that she's a cat. She wears like cat ears and a cat tail. She eats cat treats. She was sexually abused by her mom's dad. He went to prison, and she does have a place to return, but it's to mom's address, who knew this was happening and didn't do much to protect her for years. So, she absolutely doesn't want to return. When you were alluding to, like, the paper says that they'll return them to their home of origin, even if the actual abuser wasn't there, it's still not safe.
Yeah, so I'm hoping, right, she would be one that we would connect, for example, to Family Resources that would wrap her up. Joe.
Thinking out loud here, and I have not been involved in it, but we did some work with Starting Right Now and her youth homeless facility there in St. Pete. That may be a resource for our younger children, both in St. Pete, and I know they've got a facility in Tampa as well. So that may be an opportunity to find a bed or two or some assistance there. And I know the facility there in St. Pete has a pretty good sized grounds around it. God forbid we get in that temporary state where we needed to put up some tents or something like that. That might be an opportunity. But I know, as I said, we've done some work at the St. Pete facility with Starting Right Now, and that may be an opportunity if we get to that point.
Thank you, Joe, for that reminder. Karen.
So two things. So first, thanks for mentioning that Dominique was part of those meetings representing the county. I did also want to ask, I've seen the emails that have gone out regarding the updates. Is there work now being done to link up to those other COCs and those other counties while we're kind of on hold? Because the email updates seem to be going to that narrow group that started. I don't know that it's kind of this big communication to even the entire COC, because I think there's like maybe 10 to 15 people on this email. The COC membership is much greater. There may be more ideas. But I know we talked about linking up with Sarasota and Hillsborough and Pasco. And so is that work continuing? Are they receiving these updates and communication?
Receiving it's one thing, understanding and responding, it still becomes more of a, well, that's Pinellas County, that's Miami, that's Jacksonville. And so I stay in close touch with them because they have Job Corps sites. But as far as we have the FCEH, we have our peer-to-peer meetings. They network throughout they produce all those communications and just really getting it. I think that they're so focused right now, honestly, on the CoC program staying, stable federally, and because of the state budget issues, that has really been where the focus has been placed. I put out hey, y'all, people are going to be coming to your county. And so what we did was working with Job Corps, getting the list, saying who has a housing plan, who doesn't. And so we knew that we were going to prioritize like the young people who were from Pinellas County, and every one of those people were interviewed who did not have a housing plan. And so we were able to staff those during one emergency case staffing. But we also interviewed folks who were planning on staying in Pinellas County and not going back because they wanted to stay. So it was just people who resided in Pinellas County before they went to Job Corps or were actively working, employed. They pretty much had roots here. Were the first tier. The second group was people who were going to stay, and we were able to talk them out of doing that. I had some very good, Helen was excellent at that, at giving that feedback and really encouraging, reaching out to family members and trying to dig deeper to find out who could, if you had a place to stay, how could we divert? And then the remaining folks, because of the injunction, it's just been more difficult to get through and get any information. that's
Well,
really
that-
that's that. But the rest of them we would coordinate. Literally, I've told we will coordinate and make sure, give a heads up that COC, that lady, that somebody knows that this is coming. Of course, we would need, some sort of release in place as well. So we would need permission to do that, but that is something we're willing to do.
But Sherry, if there's a spreadsheet of those 260 students, do you have a column that says what county they originated from?
I do.
And if so, you could send Hillsborough COC and just say, hey, just so you know, I've got 47, students here that originated from Hillsborough, and depending on what happens,
right.
It'd be nice if you could help us, figure out what we're doing with these young adults. But
right.
So has that been sent out from whatever originating county?
Because the housing status of everyone who from other counties, like it seems to be really the people who do not have a housing plan. The career counselors are meeting one-on-one with each of the students.
Yeah.
And so we're not talking about a very 260 students does not mean 260 students are going to be homeless.
Right. But even just a heads up, like they may be working on a plan, they may have a job here or not. We're still ascertaining all that stuff, but yeah.
They have the information. I'm sending out the list because of various reasons. I have not done that yet. But that would be next with some permissions.
Yeah, I do think that again, I just think this is the time. This is the contingency planning time right now, because that we need to be doing that kind of thing. I see that you put in the chat. I can't see everything right now, but that there's 30 students who had no housing plan in place.
Confirmed.
And of those, so is that 30 of 250?
Yeah, 30 out of the 260 had no confirmed housing plan. Didn't mean they didn't respond to a survey, and there was follow-up being done by the career counselors.
Okay. So, okay. Again, I want to be as optimistic as what it feels like everybody on this call is about, that we aren't really going to have a problem anywhere with state, federal, or kids on the street. I want to be as optimistic as everybody. I just want to make sure that in the event it doesn't go the way we all believe or hope that it's going to go, that we've at least talked about, like some of the things that are in the chat here, AMI skills, starting right now, family resources, talking to other counties like Pasco and Hillsborough. I think those are some really good partners to be talking to, like right now, to say, listen, even if it's a 1% chance, right? 99% chance everything's going to be perfection and wonderful, and we're going to have no problems whatsoever. If we could just plan for the 1%, to say, if I have to call you at 5:00 on a Friday night, AMI, or starting right now, or family resources, or Pasco County or Hillsborough County, will somebody be available? Who's the person I would call at 5:00 on a Friday? Just to be on standby or something. Because what I anticipate, right, that it's going to be somebody that's sitting here on this call, that's going to get the call at 5:00, and I just don't know that we're going to be able to do it all.
Yeah, and April, to that point, if we have the list of 260 and even let's just say 40 are from Hillsborough, I don't think we need a release to say, hello, 40 of the 260 are from Hillsborough County. You don't have to give them names or housing plan, but get on a call, get on an email distribution list. Who's our person at Friday at 5 to be on the call? What plans do you have? What resources, what beds do you have? Even if they have 2, just knowing that 2 could go there in advance of, because it always happens Friday, and 5 is sometimes generous. It's like 5:30 and we're scrambling to get resources on, and that's very challenging.
So it's a heads up and at least a name of who to call if that happens, or when that happens. Yeah. Yep. We got to look at our time here, April.
Yeah, we do. Okay. So we will move on to our follow-ups from the joint May 16th meeting. And Sherry, you were going to give us an update on the household size currently enrolled in rapid rehousing and PSH and the HUD NOFO debrief?
Yes. So I'm going to show you something very quickly, and it's going to be shared to everyone after the meeting. Are you able to see this screen right here with the?
There it is. Yep.
Okay. Thank you, Arrow. I've been working with Coordinated Entry, and we've developed this for families and for individuals using that template that was used many, many years ago by Jack, I believe, and have gone through the definitions. And so those are here. What I'd like to do is send this out and get feedback from you at that point on, is this covering your needs? This is set up now in a way where I believe we can actually do more. It's more useful for coming up with data and being able to display that in graphical form and in trends and to show what's going on throughout. And so this is where we're at right now and we were able to use that spreadsheet from Arrow. And so I really appreciate that, Arrow.
Can you click on the families tab? Can we just see
Yes.
what the numbers are?
And this is the cadence that Karen had asked for, kind of that regular update of how many are on the waiting list.
Yeah, and that's the other question is I'm having this happen weekly. I don't know if you all want it weekly. So Mondays is when it drops, and so it could be ready, that week after that is when the lists are pulled.
But I think it depends on what it's being used for. So if it's being used for funding decisions, I think monthly is fine because then you can track trends over time. If we're using this for shelter prioritization, I could see the weekly, but I would think that they're using the CES list by name list for that. So
right.
I don't know how the other funders feel in here or providers, like if this list on a weekly basis is necessary or if you feel monthly is.
Yeah, and I misspoke a little bit. This is something that we will be keeping tabs on for sure on a weekly basis. So it's going to be done weekly so that we can provide some trending data as well. But I don't want to, just thinking of capacity and another report being sent out, that may not be useful to be seen that often. I don't want to encourage that for sure.
So how many families do we currently have on the list that are unhoused and how many kids?
I don't have the total number of individuals. I have the number of families here. And so that would be something that we can ask for. But the number of families who are unsheltered are 95 altogether. And that includes families who are pending closure, it takes like 60 days before a family's goes completely inactive.
All right, what's this 499 number?
Total. So this number, this is a year-to-date number of total persons within those families who are housed. This is a number that can be pulled very easily from HMIS, from our reporting system. The number of families, I want to add that to here, but that would be, it's difficult. The data depends on how people, how it's entered. And so if we have somebody puts in a move-in date of a lot of things I saw, May 6th, move-in date was entered, but it didn't show up in the system till this week because that's when it was entered, then it's going to look like one family was housed and then we lose those other 7 families who were housed last month, unless we just keep on going back in time. And so there's not a special report made for that yet.
All right, so we have 95 families and we don't know how many children that represents.
No.
Okay, so I think we should add that, we get calls because of the program that we currently operate. We get calls almost daily. Yesterday we got a call around a 17-year-old who getting ready to turn 18. But in any case, I think we need the number of kids that we're talking about. Karen.
And is there a way to differentiate those that are in motel? I mean, like those that are like street homeless.
That's a great question. I have that same question as well. I'm trying to find out if we can, because truly they're not unsheltered if they're in a motel. right now. They are
Or,
when
category
you
one
say that,
homeless,
though,
but
yes, and are they in a car? Are they
Right.
couch surfing? Where are they? Exactly,
They're-
where are they?
yeah, I mean, and all this would be category one homeless. That means in a car, not couch surfing, not so much, but
Karen, did you mean self-pay in a motel, or did you mean
I mean,
pickup
I know that
agency?
that's in that category if it's being paid for by an organization, but I think when you're looking for that call to action, when you're, wanting to say from the rooftops that we have 75 families and in each family there's at least one child that's living unsheltered on the streets in a car in an unsafe, to me, motel is not great, but it's not the street. It's not the car. It's a level of safety. So if we could split them out, I think it's important. I think back to the frequency, that number should be a weekly number because that is a pants on fire number. The rest of this, I would say, is monthly. I did have Dominique, I think, get with your team, Sherry, to make sure for the budget meeting that I had all of these in the event that certain programs were going to be cut this year so that we could say this is the return on investment, this is what we're doing, this is how many we're not serving with existing funding staying as is. But I think the unsheltered number, I think that should be coming out weekly, in my opinion.
okay.
Yeah,
I agree with Karen
will
for
just-
the very same reasons.
Yeah,
Sorry.
I do too. I will just say that, right, the reduction of funding for rapid rehousing for families with minor children that ends in March is going to impact these numbers. Because right now there is a direct referral line to Directions for Living that's bypassing everything and putting them in emergency shelter and hotel until we can find housing, and then we are first, last, and up to 12 months of their rent. It is a direct program. So
and that's one thing with the state funding that's come out that I'm looking at, because the CoC expanded the priority interventions. That's part of that CoC plan. That's what we can fund now. And so when it was like more restricted, it's opened up more. And so when we do the subcontracts, there are more projects that we can cover.
So Sherry, like you mentioned about, when the time point when data gets entered, just thinking about, so does that constantly make prior week's data change as people enter in
Not
those
for
move-in dates?
just for these numbers down here. This year to date, the total persons housed, because we HLA we depend, HMIS depends on providers to enter that information.
And
The
does it make,
rest,
go ahead.
I mean, that's more the difficult. Move-in dates can be delayed when they get entered.
And does it make sense maybe just to, on your data page where there's the performance measures on HLA's site, just to have this? So like if anyone's working on a grant application Saturday evening or whatever, they know they can pull that from the site versus having to, reach out if they're not on the email list, particularly for this, but they can get that data.
We're talking about that. We need, we're talking about ways to work that in. And one thing is, so if it's going to be like in the dashboard, we do have the dashboard. It does not have this information here, but that's something that really goes through DSP committee to work out, and creating, just trying to look at making sure that it stays updated. Again, looking at staff capacity. I know it sounds small.
Understood. No,
it sounds very
Unless
small, but it ends up becoming all these things, and like we're not able to do the thing anymore.
I hear you.
And so I'm really trying to keep an eye on that. Definitely though, reach out, and we can send this. So the total number of families unhoused can be sent out weekly. No, absolutely, we can send that number out. Let me think. So just feel free to send over take a look at it after we send this out. I'll take out my red marks here and and we'll send them and send your feedback of what would be helpful. And also looking at those definitions, those are still, those can be tweaked and expanded on for sure. It took me a while to make sure that when we say prioritization list, there's a CE prioritization list, there's a shelter prioritization list. It's like we need to be very clear on how we're defining each of these numbers. And so, yeah.
Okay, let's move you along, Sherry, to giving us an update on the takeaways from HUD NOFO.
The HUD NOFO, and going to have more of a breakdown for everybody, still putting that together. But overall, I want to share that out of 200 total points, Pinellas, we had 153.25, and so the lowest was 54.5 for all of Florida COCs, and the highest was 185. I know that's going to go past I'm going to get into some highlights here. The median was 151, and we had 153.25. So we were at least, not even average, the median, the very, very middle score, we were above that. So that's good. But the lowest area, because, highest area we had, HMIS, 100%, got all the points. Yay. For the lowest area, it was around system performance and specific. That's where we lost 26 out of 60 points. So 43% of those points were lost. And so when you look at, we had 153 points out of 200, 26, that's a good chunk of that that was lost. And it was related to reduction in first-time homelessness was good. I'm sorry. Reduction in first-time homelessness was the only really good 100%, all those. But where we got hurt was exits to permanent housing destinations and returns to homelessness. Those two areas were the hardest hit, why we lost all those points. In the other categories, we lost 1 point here and there, except for, let's see, two sections that were really, it's like a section A and a section B. Coordination with housing, coordination with federal, state, local, private, and other local groups, organizations. Those two sections, we lost almost 11 points out of 79, so that's 13%, but everything else just was 1 point lost. Pretty close. So
what
we've
is
not
that
had a
coordination?
full-on one-on-one debrief though to find
Sherry,
out.
what is that coordination though? What is it that they're looking for that we didn't accurately either do or describe around that coordination? What is that?
It is making sure that, like, having trying to think of a good group. Making sure that we have our COC membership, our board membership is covered who they were looking for, who HUD was looking for at that time. And so
well, we have lots of local elected.
Oh yeah, lots of local. It has to do a lot with state.
Yeah.
So I know Celeste is on here. It gets more specific in there, and that's why I need to dig into, because honestly, I have
I wonder if we invited, what if we invited a state or federal legislative aide to attend our meetings? Would that count? Our board of director meetings?
I'm going to review what the NOFO questions were in that area. But
Karen has her hand up. Sorry.
Some of it was getting very specific in the questions.
Okay.
Go ahead, Karen.
Yeah, I just was going to ask, when you're doing a review, is it just board composition, or is it like the work being done within the COC?
Active outreach to different groups, like disability groups. Oh, there were a lot of questions around like youth groups, youth serving organizations, which we used to have very strong. And I know we have family resources on here too, but that was one. Having, this is such a while back. Victoria may remember, there was a group.
There's a youth homeless leader.
It was there were various entities that they were like, have you done outreach that's been successful for each of these groups?
I wish that I could tell you I remembered what that was.
It's not coming, but I remember when we were when we were doing the application, there were a lot of questions like, have we done this? And it does change from year to year.
We'll need to better understand it. If we're going to improve the score, we need to fully understand who it is
what
that
it is we need to
what
do.
it is that we're not doing well, or what it is that we're not documenting that we're doing well,
Right.
so that we can improve that score. So if we can get some specifics around what questions that they were asking that we were unable to answer, I think that would be that would be.
But do the questions in the evaluation vary every year? So you're like jumping through this year's hoop?
Sometimes, yeah, there were new questions. There were, and then one of the things that's going to be difficult this next time around is there were so many questions around fair housing and reaching out to racial equity, things that don't know what's going to.
You can't win. I mean,
So
right?
it's,
Okay.
and I also wanted to do a comparison between years, and I'm still looking at that because I know we have that from other years, but just looking through, there were some changes in how each section was scored and relative to what it was before, like differently weighted than it was in the past.
Can I ask you for the exits that were not permanent housing destinations? Is that just all exits in general? So that would
All
include
exits.
outreach, that would include
It's system performance measure. Yeah, so it's looking at the whole system, not at a project. And it was exits to homelessness. No, so returns to homelessness, exits, and and the other one there was one more, and that was increasing income and employment, so cash income and employment.
Good luck with that.
But that is in thinking about like why certain certain performance
Programs
are collected. It's to really encourage that improvement, so that we can look better in that area. Yeah.
So just two things for feedback that might be worth considering is that a large number of these people are permanent supportive housing. Their income's likely not going to increase, right? Unless they get an increase in their severe and persistent mental illness, disability that's long lasting. Right. They're not able to work. And the other thing is that I would look at, because I think we have a pretty robust outreach. And as far as the touches where they're not a permanent housing exit, how many of those would be street outreach? I feel like that if that's a larger number, that's something way different than permanent exits from permanent supportive housing or rapid rehousing, right?
I see. Yes. Yeah.
Because I'm not sure how, what street outreach teams are documenting in HMIS, but we do have a lot of different street outreach stuff. And if that's where the predominant number of touches are coming from, that should be known. That are, not exiting to a permanent destination.
I will say, as far as like when talking about PSH and folks who may not be employed and increasing income, that was one area that was done well. That did show improvement. And that's why we received points for it, was for folks that their income improved or increased regardless of whether it was from employment. So basically it's being documented. This goes back to just being documented in HMIS. It's looked at system-wide, not project-based. And that's why we really pushed for that information to be put into HMIS, because that's what HUD's looking at. And so if anytime, every year, if there's a COLA for Social Security disability income, that it gets documented, it helps. It makes a difference. And
okay, we are basically at our time.
We're over. Yeah.
Slightly over. Sherry, I'm assuming you're going to be able to provide a more detailed level of that kind of feedback so that we can take action in the future with strategy around how we're going to improve those, where we lost the majority of those points. What was remaining is the PIT report feedback. Is that something that can be provided electronically?
Sure.
Okay.
Yes.
And then the last thing is public comment. I do want to make sure we leave time for public comment. If anybody has comment that for the good of the order that you would like to share.
This is Victoria. I'm just going to note that Boley's housing waitlist opens, I want to say on Monday, for 1-bedroom units. So I'll do that little plug. And Well, if you don't know that SAF, St. Pete SAF applications are due at 4 o'clock, here's a reminder for that as well.
And those Boley 1-bedroom units, they are not PSH units. Those are through our housing department. It is just like a housing voucher.
Good, thank you. Okay, very good. And then is there anything else for the good of the order? You can see in the agenda about encouraging everybody to use the leak pamphlet that came from the leak group.
Yep.
So if you need
interacting with law enforcement,
Yeah,
yep, they developed it and want that distributed if you could. Any providers have it.
Sure. If you can get with HLA staff to get those pamphlets, if you're in need of them, to be able to spread the word with the individuals that you are serving and or living in your housing and that kind of thing, that would be helpful. Okay, anything else for the good of the order? I appreciate everybody going 8 minutes over. It's been a lovely conversation and discussion. I hope they will continue, and I hope everybody has a great weekend.
Thank you.
Thank you. All right, bye.
Thank you.